Hi, namaskar, dear students, and good morning. So today we are going to discuss about the Q&A question and answer session for heart failure and digoxin. But in previous week we didn't have any class, so this is a little bit longer gap. So we are just going to recap the whatever concepts that we have learned. Okay, so this is considered as quick revision. So whatever points you have already studied, we are going to touch upon those points in few minutes, and then we can start the question answer. So freshly you can get the better understanding about the question answers. Okay. So first of all, heart failure. Heart failure name itself is indicating the heart is not functioning properly. That means what? The heart is not pumping properly. Okay. So thus the pumping is called the ejection fraction. Ejection fraction. So based upon that, we can classify heart failure in two different groups. One is the ejection fraction is less than 50% or is more than 50%. Okay, so this is a very important benchmark or the indicator. On based upon that, the treatment regimen and the severity of the disease can be defined. So left ventricular ejection fraction is less than 50%. That's called the systolic heart failure, and it's more than 50%. That's earlier called the diastolic heart failure. Okay, so the basic classification of the heart failure is ejection fraction. Okay, then the second part is the treatment regimen. Here, what is the big difference between these two? This is very severe condition, this is relatively less severe condition. Okay, so when we comparing the treatment, that's the quadruple therapy is important for heart failure with reduced ejection fraction. Quadruple means four different class of medications. One is we are trying to control the renin-angiotensin system, because the heart failure patient compensatory mechanism renin-angiotensin system became more activated. So we have to control that. So renin-angiotensin system. Second is beta blocker, because the sympathetic system is overactive. Third is aldosterone antagonist, and the fourth one is SGLT2 inhibitors. This is a newer recent class of medication that is using for the heart failure patients. Regardless, this medication is used for diabetes patient, type 2 diabetes patient, but recently this medication is used for heart failure patient regardless of diabetes, and also in the both category, ejection fraction less or is normal ejection fraction. In both conditions, also the patient is not suffering from diabetes or suffering from diabetes, this medication is playing very important role. So this important point for your exam point of view, important questions you can get it from here. Okay, what is the rationale for the management of the heart failure patient? Relieve the symptoms, exercise tolerance, reduce the hospitalization, and reduce the mortality. Okay, before we start doing the treatment, we have to find out the precipitating factors. What the main cause of heart failure? Okay, other cardiovascular conditions or other conditions like anemia, thyroid function, NSAIDs, verapamil, other medications, or other cardiovascular condition. Due to this, heart failure is executed. So in that situation, we can manage the other underlying conditions, so get the better result for the management of heart failure. Perfect. Okay, renin-angiotensin system medications can be classified in three different groups. One is ACE inhibitors, that's the normal ACE inhibitors. Second is sacubitril with the valsartan. Valsartan is ARBS. Okay, and sacubitril, this medication is considered as a the sodium outflow, that's improve the sodium outflow, that's a diuresis, vasodilatory effect, reduce the fibrosis, cardiac remodeling, So this increase the positive peptides. Those peptides are useful and that reduce the sodium concentration in the body. Okay, so this is important combination. If the patient is unable to take ACE inhibitors and this combination, then we can go with the ARBs, okay, angiotensin receptor blockers. Okay, enalapril superior to enalapril. That means this combination is better than the ACE inhibitors, and sartans can be used when ACE inhibitors or this combination is not tolerated. So you have to understand what is the steps for the selection of medications. ACE inhibitors combination, if these two are not appropriate for the patient, in that situation we can go with the ARBs. Beta blockers, what beta blockers are used? Bisoprolol, carvedilol and control release metoprolol. Okay, second important thing is the condition for using the beta blocker is patient should be stable and euvolemic. That means the cardiovascular function and the pressure is normalized, then only we can use the beta blockers. Okay, aldosterone antagonist. Aldosterone antagonist, eplerenone is more specific compared to spironolactone, but eplerenone and spironolactone, these medications are used. But when we are using these medications, always we have to look for the potassium level, hyperkalemia. Especially when we are using with the ACE inhibitors or ARBs, this also increase the potassium level, and this aldosterone is also increase the potassium level. Okay, so this combination can significantly increase the risk of hyperkalemia. So that is important question you can expect from that information. SGLT2 inhibitors with or without diabetes. This is important word that you have to keep in mind. Okay, and that reduce glucose level, that means osmotic effect, and due to that the diuretic can be executed. Diuresis, due to diuresis, dehydration and hypotension also the patient can experience. Loop diuretics important especially for low ejection fraction, because low ejection fraction fluid accumulation is the main concern. Fluid accumulation, excessive fluid can be outflow with the help of strong diuresis like loop diuretics. Digoxins are also important, especially when the patient has low ejection fraction. In that situation, there is a positive ionotropic effect, and positive ionotropic effect that improve the ejection fraction. Ivabradine is used for angina patients, but the most important thing is that reduce the heartbeats. So the patient must have to be sinus rhythm should be normal, and the heart rate should be more than 77 beats per minute. If it's not more than 77 beats per minute, then that increase the risk of arrhythmia. That is very important point. Where is it get this medication is a nitric oxide concentration related, so it's the smooth muscle relaxant medications, and that also used for heart failure patients. The practice point, patients should have to monitor the weight on a regular basis and continuously in 2 days 2 kilogram weight increase. That means the significant fluid is accumulated in the body, and that is a strong indicator for the patient's heart failure is getting worse, and he has to contact his doctor. Okay, so these are the key important points that you have to keep in mind while you are understanding the heart failure. Okay, already we have covered this in heart failure. Let's quickly review the digoxin. The first is the class of medication. Digoxin is a cardiac glycosides. Mode of action, two important mode of action. One is to slow down the heart rate. That's why this use for atrial arrhythmia, okay, atrial fibrillation and this kind of arrhythmia. Second is increased myocardial contraction. So this is called the positive ionotropic and this is called the negative chronotropic. These two unique mode of action, and due to that this used for two unique kind of indications. That's used for the atrial fibrillation, atrial flutter and heart failure. But the most important thing is digoxin should not be used for the patients those who have ventricular arrhythmia, because that is a side effect of digoxin. You can definitely expect the questions from electrolytes and the other disease conditions like hyperthyroidism that decrease the digoxin level and hypothyroidism increase the digoxin level. Okay, so what is the correlationship between the digoxin effect and the thyroid function? This is very important point that you have to keep in mind. Then the electrolytes imbalance, hypokalemia increase the sensitivity, and hyperkalemia, that is reduce the activity or reduce the sensitivity. Okay, so the potassium level is very important, very important. Okay, contraindications in various situations, already we have discussed this part. So electrolyte, drug interaction, digoxin. When you are learning the digoxins, always you have to understand the drug interaction, because the narrow therapeutic window. Second important thing is digoxin has lots of other medications are interacting with the digoxin directly. Second important thing is 70% of the digoxin is eliminated through renally. In that situation, if the medication is changed the renal function, that also change the digoxins. The third important thing is the medication that change the electrolytes, also that change the effectiveness of the digoxin. The two important medications that we had discussed in the main class is the amiodarone and the quinine. Okay, so these two medications are also used in cardiovascular problems, especially in arrhythmia patients. So if the patient is taking these medications and if we need to start with the digoxin, always we have to start with the lowest possible dose. Okay, 70% renally eliminated. Pregnancy, that's a comfortable. Adverse effect, that is very important part, because digoxin toxicity and toxicity management. Okay, you can expect questions from there. Digoxin toxicity, the most common side effects like anorexia, nausea, vomiting, diarrhea, visual disturbance, drowsiness, dizziness, bradycardia, arrhythmia, headache. So these are the most common symptoms you can expect. When the patient is suffering from digoxin toxicity, we can classify patient with the change ECG and is without change in ECG. That means the arrhythmia is experienced by the patients or not. If only these kind of side effects, that a treatment regimen should be different compared to the patient has a severe effect on the cardiovascular system. Okay, DZFeb, fragmented digoxin antidotes. Okay, so that is the most important part for the management of digoxin toxicity. Okay, loading dose normally is not required, but it's a oral loading dose should be okay. Normal dose you can consider 62.5, normally 125 to 250 microgram daily. But the patient with the renal impairment, we can start with 62.5 microgram. Okay, steady state concentration required 7 days, half-life is 36 hours. When TDM, therapeutic drug monitoring, always we have to consider gap between the dosing and sampling should be 6 hours. This is also very important question, sometime you can expect in your exam. What is the therapeutic range? 0.5 to 2 microgram per liter. Okay, it's compatible with everything. Okay, So these are the important points that quickly we have done the revision. Now we can jump into question answer session. Okay. So let's we quickly start the question answers. What is uh, what is the ejection fraction threshold for diagnosis? That means how we can define the heart failure on based upon the ejection fraction. So that is less than 50%, that is called reduced ejection fraction. And second is heart failure with the preserved ejection fraction, that is more than 50%. So that's the reduced means it's less than 50%. Which drug class is used for both preserved and reduced? Also with or without diabetes. Okay, SGLT2 inhibitors. This medication is significantly reduced mortality in both the patients. What is the purpose of using quadruple therapy? What is the purpose of using quadruple therapy? Prolong survival and reduce hospitalization. That is obvious. Name of the four component. What are the four different class of medications? Quadruple means four medications class used for reduce ejection fraction heart failure. One is renin-angiotensin system, second is beta blocker, third is aldosterone, and fourth is SGLT2 inhibitors. What is the first step before starting treatment in heart failure? Before starting treatment, we have to find out the underlying cause and the precipitating factors. That means the other cardiovascular problems or other disease condition or other drugs. Okay, cardiovascular conditions, other disease conditions or drugs. Okay, so on based upon that we can correct it. For example, if the patient is suffering from anemia, so our main objective is to correct the anemia that can improve their cardiovascular functions. Okay, which diuretic class is preferred for symptoms relief? Because the heart failure ejection fraction is low, that means the fluid is accumulate and that excessive fluid need to be flushed out from the body, and that's why strong diuretics like loop diuretics are the important substance. What are the AC inhibitors used in reduce ejection fraction? Okay, improve the symptoms, reduce hospitalization and prolong survival. How often AC inhibitor dose to be titrated? In every 2 to 4 weeks, because we have to review the renal function and also the electrolyte balance as well. Which combination drug has shown the superiority over the enalapril? What combination? This combination of the sacubitril and the valsartan. Okay, that's significantly improve the survival in the patient, those who are suffering from heart failure. This combination has two unique things. This is ARBS and renin-angiotensin system, that's directly act on that, and this substance is act on the sodium related peptides. Okay, nitric peptides breakdown inhibits, and due to that cause the diuresis, vasodilatory effect, and it's really beneficial for the heart failure patients. Name two conditions where statins are preferred over AC inhibitors. In what situations the AC inhibitors and sacubitril are not tolerated? That means the patient is experiencing the side effects or due to other contraindications. In that situation, we can use ARBS, but initially we preferred the ACE inhibitors or the combinations. Which beta blockers are recommended for heart failure patient? Bisoprolol, carvedilol, and control release metoprolol. When should beta blocker therapy be initiated? Because beta blockers should be start when the patient is cardiovascular and also the pressure is normalized. Okay, so euvolemic. U word is very important. Euthymia, okay, euthyroidism, that means clinically and biochemically thyroid function is normal. That's called the euthyroidism. Euthymia, that means the behavior is normal. Euvolemic means the volume and hemodynamic situation is normal. What is aldosterone antagonist associated with? That's the reduced death, hospitalization, and improved symptoms. Which electrolyte imbalance is risk at aldosterone antagonist? Okay, so aldosterone antagonist, when the patient is taking, he is likely to develop hyperkalemia. Can SGLT2 inhibitors be used for non-diabetic patient? Yes, that can be. What is the main benefit of loop diuretics? Okay, relieve the symptoms of the fluid retention. Does digoxin reduce mortality? No. In which heart rate and rhythm condition ivabradine recommended? Ivabradine is normally used for patients those who are suffering from angina, but it's used for heart failure as well. This medication is mainly SA node conduction is inhibit. That means that reduce the heartbeats. Okay, so always we have to prefer the ivabradine when the sinus rhythm is normal and the heartbeat is more than 77 beats per minute. Okay, what is the role of Vericiguat in heart failure? Reduce the hospitalization in cardiovascular. This medication is kind of improve the nitric oxide function. Due to that nitric oxide, there are so many examples in our pharmacology. That's the nitric oxide related medications, like for example is Viagra is also the vasodilatory medications that functions through this. Nitrates also functions through this mechanism, so that relax the smooth muscles is caused the vasodilation. Due to vasodilatory effect, that decrease the preload and afterload, and that's why the patient can get benefit in heart failure. Okay, so it's artery and vein both are dilated. What is the weight gain threshold? Okay, 2 kilo in 2 days. That means the fluid accumulation, because in 2 days 2 kilogram, that's not a fat accumulation, because that's the weight change due to fluid retention. So these are the questions. Now quickly go through the digoxin related questions. What is the class of digoxin? Cardiac glycosides. How does digoxin affect the AV node conduction? Okay, AV node conduction, reduce the conduction. Okay, reduce the conduction and increase the vagal tone. Vagal tone means parasympathetic. Okay, that is parasympathetic. Reduce the conduction. That's why this is used for arrhythmia. Two indications: atrial fibrillations and heart failure. Which thyroid condition increase the digoxin concentration? That's the hypothyroidism. Okay, what electrolyte disturbance most increase the digoxin toxicity? That means increase the digoxin sensitivity. Hypokalemia. That means the electrolyte related, if you are going to learn the electrolyte related explanation I have done in clinical science class in a tabular form with all the electrolytes and effect on digoxin. Why should digoxin be used carefully in sick sinus syndrome? Because the risk of severe bradycardia and SA node block. What is the risk of using digoxin after cardioversion? Okay, cardioversion means we have corrected the rhythm, so increase the risk of arrhythmia. Okay, so we have to be very careful about the defibrillation or anything that we have done. After that, digoxin should be avoided. What percentage of digoxin is renally cleared? 70%. Digoxin is preferred in pregnancy. Yes. The one common GI side effect, nausea. What is the therapeutic range of digoxin? 0.5 to 2 microgram per liter. Digoxin level toxicity usually appears after 2 microgram per liter. These are the very factual based questions. But also you have to remember, because digoxin is considered as the very, very important medication for your exam point of view. So the oral maintenance dose for adult is 125 to 250 micrograms. If the patient has a renal impairment, then we have to start with the lowest possible dose, 62.5 microgram. What is the IV onset? Onset of XN in IV patient 5 to 30 minutes. Intramuscular administration, no. The loading dose typically achieved in oral route, that should be fine. ECG change may be seen in digoxin. Okay, what are the prolonged PR, ST depression, and TVIV inversion? So digoxin be used to convert atrial fibrillation to sinus rhythm? No. What is the target ventricular rate in atrial fibrillation treatment with the digoxin? Less than 110 beats per minute. Okay, so some of the important points that you have to keep in mind about the digoxin interaction, TDM, therapeutic values, dose. Some of the students are continuously asking the question, do we have to remember all the dose? No, you don't need to remember all the dose, but some of the medications that most commonly used and are low therapeutic window medications, those need to be remembered, like digoxin. Okay. So thank you very much for joining today's class, and see you in the next class. Have a great time. Bye bye. Take care.